Dunbar.
Thank you, Mr. Chairman. Good afternoon. Whenever we get the budgets, or proposed budgets, we tend to look at things, look for anomalies and things that don't look correct analytically. And as I was going through the Department of Health's budget, there was one thing that kind of jumped out at me is in the proposed 16-17 budget, there was only one single line item that was reduced. Just one line item that was reduced to the 15-16 numbers, which kind of jumped out at me a little bit. And then, of course, when I looked at it, is something that, for personal reasons, is very important to me, and that's the adult cystic fibrosis line item. In the 15-16 budget, it's not a big number, but it is something that is very important. The 15-16 budget, it was reduced by 41% through the line item veto. And then that number was then reduced another 22% in the governor's proposed budget for 16-17. Understand that, to me, this is something that Pennsylvania's become a leader, actually, in research of cystic fibrosis. And they're not just working on treatment, they're actually getting to a cure with use of the drugs Kalydeco and Orkambi. They are actually making headway. Life expectancy in the last decade has increased from 35 to 42 years old. And my question is, why the cut? And
That was my question also. So as a former CEO, I do the same thing you did and look at percentage changes. And what I was, the information that, because I was concerned about the line item as well. And in actuality, we took while the number had been increased for several years in the budget, the actual spend was exactly what we have it.
I can find ways to spend it.
Well, there's
make a lot of recommendations.
There's only, as you well know, this is very prescriptive. So we did not, it is not a cut to services. It is not, we put the dollar amount in that historically for the last 5 years has been the number that was expended.
And that was the reduction in 16-17 or the line item veto?
The reduction 16-17.
Okay, and the line item veto took out what? Because that was a 41% reduction there.
I'll have to go back. I know that we confirmed our 16-17 numbers were, in actuality, what we had expended over the last 5 years. So I will go back and get that information for you.
I would appreciate
Sure.
that. Thank you.